Macular degeneration. My mother thought that she would get in her car and drive around the country when her children left the nest. However, my mother developed macular degeneration 16 years ago and now relies on her children to drive her to the store and to the doctors. Today I want to inform you on what macular degeneration is, what resources there are for people who have macular degeneration, and some things you can do to prevent getting macular degeneration. Macular degeneration is a vision-robbing disease. The symptoms of macular degeneration are outlined in the first year related macular degeneration, an essential guide for the newly diagnosed, written by Daniel L. Roberts. Some of the symptoms include difficulty distinguishing colors. Things might start to look a little faded. Seeing floaters is a symptom. Some people call floaters worms. They feel like they're seeing worms when they're looking around at things. Seeing flashes of light is another symptom. All these things should be checked out by your vision care provider. According to twin brothers, Drs. Mark and Michael Rose, macular disease is the #1 cause of blindness in older Americans. In fact, they write in their book, Save Your Sight, that almost 30% of all older Americans will get macular degeneration. Here are some of the risk factors for macular degeneration. The most prominent one is age. People over 55 are more likely to get macular degeneration. Heredity is another factor. Smoking is a risk factor, and poor circulation. And believe it or not, light-colored eyes is another risk factor for macular degeneration. And sun exposure. Here is an example of what the vision of somebody with macular degeneration might look like. This example was provided by the CDC. Central vision is most affected by macular degeneration, so patients need to learn how to adjust. Some people with macular degeneration will become totally blind, and some just legally blind, which means they will still have part of their peripheral vision. There are two types. There is a dry form and a wet form. The dry form, you lose your vision slower, and the wet form, you lose it faster. That's how it was for my mom. Losing independence is a big deal for those with macular degeneration. They have difficulty reading, recognizing faces, and they have difficulty driving. There are resources available, though, for those with macular degeneration, like my mother. She attended the Iowa Department for the Blind Orientation and Adjustment Center. As you can see in this image of her in the Des Moines Register, April 13, 2000, they cover students' eyes to ensure that they are totally reliant on their other senses while being trained to adjust to declining vision. She also learned to use a white cane to walk around parts of the city. Safety is a huge concern for people with macular degeneration. She also uses magnifiers to do her checkbook and read her Bible. And she scoots her chair so that her nose is touching the screen of a TV so that she can watch her favorite shows. However, she will never be behind the wheel of a car ever again. The good news is there are things that you can do to prevent macular degeneration. Dr. Bruce P. Rosenthal and Kate Kelly recommend in their book, Living Well with Macular Degeneration, that you do these things. One thing you need to do is take vitamins. My oldest brother and I's doctor has recommended that we take lutein and xanthan to help prevent us from also having macular degeneration. But the best way to get these vitamins is to eat your veggies like your mother told you to. You also need to exercise daily to keep the circulation and blood flowing so that waste doesn't accumulate in your eyes. And smoking is a big thing that you can not ever do and not have to worry about that being a risk factor, because smoking ruins your circulation. And the last thing that you can do to prevent getting macular degeneration is to wear your sunglasses. You need to choose ones with 100% UVA protection, though. And people with light-colored eyes, really this is important for them because the lighter your eyes are, the less melanin you have in your eyes, which is your natural protection against the UVA rays. So in conclusion, macular degeneration is an eye disease that affects many older Americans and robs them of their central vision. But there are things available to help you adjust to your life with macular degeneration, and there are things that you can do to prevent it. I hope that you have found this informative. Thank you. Show the audience again, please.